Hello. Thank you for downloading the second installment of our webinar series, Eye Tracking, a Catalyst for Healthcare Innovation. This is a re-recording of Part 2, titled The Future of Medical Assessments and Treatment. My name is Amanda Bentley, and I'll be guiding you through today's content. If you missed Part 1, no worries. I'll give you a quick recap. And it's available on demand at the link at the bottom of this page, probably the same page where you downloaded this webinar. In Part 1, we discussed how eye tracking adds new functionality and features to conventional medical devices, enhancing workflows, security, safety, and wellness. We also looked at how it optimizes system resources and how it can speed up training and skills transfer. We also touched on how tracking eye movements aids in the detection and treatment of some of the world's most prevalent diseases. And today, that's what we're going to take a deeper dive into. In this session, I'll briefly walk us through the history of eye movement research as it pertains to this topic. I'll describe some of the critical movements of the eyes that health professionals look at when measuring our brain and visual health. We'll look at how using an eye tracker to digitally and objectively track these movements is advancing the screening and treatment of illness. And I'll show you a snapshot of some of the existing solutions available today and highlight the benefits in using eye tracking in these solutions. Some of you may know me from the Part 1 of the webinar series, and some maybe from other interactions. If you don't know me, I'm Amanda Bentley, a director for Tobii Tech in North America. I work predominantly with healthcare partners that are integrating eye tracking technology into their own solutions. Before Tobii, I worked in various research roles, most notably leading a team focusing on improving messaging for personal health. I spent part of the last decade working with eye tracking technology and helping to make it accessible for researchers and organizations who use this amazing tech to advance the way healthcare professionals assess and treat illnesses. I'm excited to share my learnings with you, and I hope you will find this information as fascinating and remarkable as I do. So with that, let's take it back to where it all started and look at the history of eye movement research. Years of research has been dedicated to understanding how eye movements serve as a window into the brain, giving us clues about neurological function and processes. And we know that when our brains are not healthy, our visual behaviors and our eye movements will often help tell the story of what is ailing us. And thanks to all that work, it's been shown that there is no tool like an eye tracker to non-invasively and accurately measure these movements, uncovering these hidden aspects of cognitive impairments and vision issues. Though the idea of the mind-eye connection goes back centuries, when we look at the research history, we see most of the literature points to 1879 as the onset of ocular motor research. This is when French ophthalmologist Jabal made a breakthrough discovering that our eyes make a series of short stops and quick movements while we read. Prior to this, it was thought that our eyes move smoothly. We now know these movements to be fixations and saccades. It was these findings that fueled a lot more research. And in 1908, Diefendorf and Dodge published a landmark study of eye movements in psychiatric patients, laying the foundation for much of what we will discuss today. It was also one of the first uses of a mechanical device to record the eye movements. And then in preceding decades, researchers start to see the correlation between fixations and attention and interest, and the use of eye tracking really started to grow with the behaviorist and experimental psychology movements. And we see in the 1960s through 90s that much of this work was replicated and improved upon. Researchers continued to study the psychology and physiology of the eye and what it can reveal about perceptual and cognitive processes. And in a large finding, we learned that tasks actually largely influence the movement of the eye. And then eye tracking research continued to expand rapidly over the last half of the century, mostly due to huge improvements in the tech, which made it more accessible. And if we fast forward to today, we have thousands of publications and groundbreaking studies describing how eye movements and ocular events are used as a biomarker to assess different aspects of health in the neural and visual systems. We won't focus on the specific studies today. If you are interested in the research, please reach out to me after the webinar. I can point you to some really great articles to read. We will, however, focus and talk a little bit more on these key eye movements and ocular events that are investigated in much of the research. In the first webinar of the series, we reviewed how eye trackers work and some of the movements of the eye. So let's build upon that discussion. As a reminder, today's commercially available eye trackers come as computers and tablets, as peripherals that may plug in by USB, glasses, and virtual reality headsets. And companies can also purchase platforms to integrate the eye tracking components into their custom designs. And we see assessment and treatment solutions built with all of these different configurations. The beauty of the eye tracker is that it digitally quantifies eye movements or combinations of movements and translates them into objective metrics and visualizations. When properly analyzed, this data provides a large source of information about a person. In applications built to track the eye and derive metrics using advanced statistical methods and machine learning tools, they provide an unbiased way to identify abnormal eye movements in people with suspected health conditions, behaviors that aren't present in healthy individuals. The eye data serves as a biomarker for detecting these conditions. So with that, let's look at some of these insightful eye movements. I always like to start with the fixation. We looked at this in part one. They are very common movements that researchers analyze to make inferences about cognitive processes or states. During the fixation, the eye stops to focus, though not completely static, but it stops so that we can stabilize the scenery on our fovea. The fovea has the high-density photoreceptors, so we do this so that we can see clearly. And the rapid motion that takes our eyes from fixation to fixation is a saccade. We perform them voluntarily when we purposely look at an object or subconsciously as reflexes to objects in the world around us. Therefore, they're usually analyzed and studied in relation to a specific task and stimuli. For instance, the anti-saccade task is common for testing brain dysfunction by assessing the brain's ability to inhibit a reflexive saccade. In this test, the patient is asked to fixate on a central target. It could be a small dot, could be a cross like you see here. A new stimulus is then unpredictably shown to the left or the right of the target, and the task is to inhibit a reflexive eye movement towards it and instead voluntarily look in the opposite direction away from the stimulus. Inability to inhibit a reflexive saccade is considered an error. An analysis of the errors or latencies of the anti-saccade indicate a dysfunction then in the frontal lobe, the part of the brain that controls saccades. We will revisit this again in a few moments when we talk about specific conditions, and there's more to this test in that you also measure prosaccades by instructing a patient to intentionally look at a target. This helps provide context and baseline, and then also memory-guided saccades, which are also impaired by a variety of neurological disorders. But for today's purposes, we will keep it simple. While saccades are fast movements, slow movements largely correspond to pursuit. Pursuit is the smooth eye motion that occurs voluntarily when the eyes track a moving target. In contrast to saccades, we perceive detail during this movement. For the pursuit to occur, the visual target needs to move at a relatively low speed. Very few people, usually only highly trained people, can move their eyes this way without focusing on something. Pursuit tests are common for examining patients with suspected neurological and vision issues, and especially tests that combine pursuit with other eye movements, like the optokinetic test, for example. In a computerized version of this test, the patient views a series of horizontally moving vertical bars on a screen, like you see here to the left. And then during this test, the eyes should perform a series of smooth pursuit and saccadic movements. The patient tracks the moving bars using a pursuit, and then when it moves out of the field of vision, the eye goes back to the position it was in when it first saw the bar using a saccade. The alternating slow and fast movement of the eyes in response to the stimuli is called optokinetic nystagmus. It's a normal reflexive response controlled by the vestibulo-ocular system. It happens so we can follow objects and motions while our heads are stationary. It's often used to assess visual function in hard-to-assess patients like infants and in diagnosis of disorders of the central nervous system. I do want to note that optokinetic nystagmus is different from pathological nystagmus. Pathological nystagmus refers to any type of nystagmus caused by a disease or an illness. Now we look at vestibulo-ocular reflexes. They're another image stabilization mechanism. They allow us to see when our heads are moving. As the name suggests, this movement works tightly with the vestibular system in the inner ear. When the inner ear directs head movement, it triggers a countering rotation, moving the eyes the same distance but in opposite direction of the head. We do this to keep the object at the same place on our retina. Without this reflex, we'd be like owls, only able to move our gaze direction by moving our head. The response differs from smooth pursuit in that it's compensation for head movement, while smooth pursuit is compensation for object movement. When patients show abnormal vestibular ocular reflex, there is likely vestibular dysfunction. Testing the reflex and other eye movements provides meaningful diagnostic information that can be obtained through no other vestibular test, helping aid in appropriate rehab for the condition. Much of the time, our eyes move in the same direction simultaneously, but there are times when the eyes move toward or away from each other. This is vergence, and we do it to align the fovea when we shift attention between near and far objects. Our eyes converge, rotating inward, or diverge, rotating to become more parallel, to keep what we focus on centered in both eyes. The mechanism and control of vergence involves complex neurological processes. Vergence issues are some of the most common visual problems following a brain injury. And lastly, there's two ocular events that are often looked at alongside eye movements, and that it's the dilation and constriction of the pupils, known as pupillary response, and blinks, and mostly the frequency of blinks. Measurement of these events is often an important source for understanding cognitive and neural processing. That wraps up the eye movements and events I wanted to cover for today's session, and now we'll transition into talking about how these movements and visual behaviors, or better yet, abnormalities in these movements and behaviors, can be a biomarker for diagnosis and used in monitoring and treatment of specific health conditions. I've used the term biomarker a few times today. I understand this may be a new term for some, so I'll quickly define it. Biomarker is short for biological marker. They're measurable indicators of a person's biological state. And an ideal biomarker is measured objectively, safely, and easily, is relatively cost-efficient, and consistent across gender and ethnicity. Common biomarkers used in clinical assessments that you may be familiar with are blood pressure or cholesterol level. They monitor and predict serious illnesses such as cardiovascular disease. Biomarkers may be used alone or in combination to provide a detailed picture of how healthy a person is and whether a diagnosis needs to be made. And then there are three main areas where eye tracking proves to be a central biomarker for detecting disease. And this is brain health, behavioral health, and visual health. And it makes sense as these are three tightly connected areas in the human body. So let's start looking at brain health, and specifically neurodegenerative diseases. In recent years, eye tracking has become a proven biomarker for detecting Alzheimer's, Huntington's, and Parkinson's diseases. The gaze patterns of patients with Alzheimer's disease will differ quite a bit from healthy individuals, and you can see this when you look at how they view mundane stimuli like a clock. The timing and duration and frequency of the features that they look at differs quite a bit. So does their reading patterns, so you can actually use analysis of the reading patterns as another way to identify Alzheimer's disease. And if you were to give a patient an anti-saccade test, you could see Alzheimer's patients will also show longer latency, and they are slower to initiate smooth pursuit movements when following a target. And you can also see latency and air rate of saccades and anti-saccade tasks beneficial for identifying Huntington's and Parkinson's. With Parkinson's specifically, you can also see the increased anti-saccade air may serve as a biomarker to differentiate in early stages between Parkinson's and other diseases. And measuring smooth pursuit and optokinetic nystagmus abnormalities can also help detect mild motor impairments. What's remarkable is that eye tracking can detect traces of these diseases that can appear years prior to clinical diagnosis, allowing for early intervention and treatment to improve the relative progression of these diseases. It's just wonderful. Rightfully so, there's a spotlight on head injuries such as concussions. Concussions are prevalent in athletics, which we hear about quite often. but they are typical injuries for people who suffer a fall or a car accident as well. Concussions, just like any other form of traumatic brain injury, can have long-term cognitive, physical, and emotional effects. It's estimated that up to 90% of concussions result in vision and balance issues. People will experience a variety of symptoms that can vary in severity, onset, and duration. Because of this, doctors have long used eye movements to assess the presence of a concussion, specifically assessing saccades, vergence, pupil, and vestibular ocular reflexes. Recent research published by our partner Right Eye validates that tracking vertical smooth pursuit can help doctors accurately and quantifiably differentiate patients with moderate and severe traumatic brain injury. And then eye tracking can also aid in assessing a patient's issues following a stroke. So analyzing gaze patterns can help highlight motor skill deficits that affect the eyes, visual field loss, and difficulty tracking targets. And these measures can add extra insight into how to treat and rehab a stroke patient. Saccadic deficits are common in those who suffer from mental disorders, and therefore standardized tests that help measure these deficits, as well as smooth pursuit and fixation stability and scan path, will help assist in the proper diagnosis of mental disorders, specifically in schizophrenia. In tests for schizophrenia, you can actually find distinctive features that will classify schizophrenia from other mental disorders. If we look at neurobehavioral disorders, many researchers are working on solutions to screen for autism. Visual tasks that track and measure how high-risk kids view people versus mundane objects like shapes will help identify autism. Typically, developing children focus on the people, whereas children with autism tend to look more at the objects. Others have created tests for babies as early as 6 months to try to detect autism sooner than the typical diagnosis. The typical diagnosis is usually made around age 2. If a screening tool catches it earlier, then there's hope that the early intervention can drastically improve the child's quality of life. Researchers are also looking at pupillary response and deficits in control of saccades and antisaccades as other indicators of autism. Right now, several researchers and companies are in clinical trials testing these solutions, and we hope and expect to see some products hit the market in the near future. Eye movements also help doctors differentiate between fetal alcohol syndrome and attention deficit hyperactivity disorder, ADHD. Though these diseases have similar symptoms, the treatments are very different. And visual tasks for children who suffer from these diseases is also very different. They differ in how they look at the stimuli. And these differences cannot be observed with the naked eye. They require tracking and computational algorithms to decipher. Eye tracking also aids in the diagnosis of dyslexia, as it can track and quantify the abnormal reading patterns found in individuals with the disability. And to build on that, eye tracking naturally makes sense in evaluating reading and vision-related learning difficulties in children. This is extremely helpful because a child may have 20/20 vision, but vision is much more than just clear eyesight. It's also the capacity to take information in, process and comprehend it, and act on it. Due to vision problems, a child may not be processing visual information efficiently and productively. And unfortunately, traditional vision screenings done in schools don't detect eye movement issues or visual processing deficiencies. However, eye tracking tests that quantify visual patterns and abnormal movements aid in determining the vision issue and can help create a path forward to help improve learning and reading efficiency. And it's not surprising that eye diseases negatively impact eye movements as well. So, for instance, visual tasks can be used as a biomarker for assessing visual field damage, like glaucoma, and measuring deviations in a patient's gaze to help for a quick diagnosis and alignment issues like strabismus. Though there are others, the last condition that we will look at today are vestibular disorders. The vestibular system can be damaged by disease, by aging, head injury, or even sometimes for no apparent reason at all. And vision plays a vital role in our ability to balance and orient ourselves, so therefore eye motion assessments are often used to test vestibular dysfunction. Deficits can be seen in saccade, smooth pursuit, optokinetic nystagmus, and vergence movements. These eye movement tests are usually combined with other vestibular, auditory, and reaction time tests, measuring the time it takes the brain to react to stimulus and initiate movements in response to a stimulus. Now that we've identified some of the conditions, I also want to talk briefly about the treatment. Because in addition to all the detection benefits, the eye also gives us a glimpse into how we are healing. And eye tracking is an amazing tool in treatment and therapy because it helps to quantify the impact that the training and therapy is having on the patient, and it can objectively monitor and track that progress. Today it's applied in applications built to counteract effects of diseases, like games or exercises that increase neuroplasticity or provide cognitive rehabilitation, and in games or exercises that are designed for ocular motor training, so where you train the eyes to move in specific ways to help treat or cure the disease. And these movements can be done consciously or subconsciously. So eye tracking is improving applications that treat many of the same conditions we just talked about, as well as a few others. So for instance, in PTSD treatment, eye movement therapy has been proven to be effective in treating trauma and other mental conditions for some time now. And then tracking these movements, like smooth pursuit during this therapy, measures how the patient is improving and can also help doctors understand the stimuli that triggers emotional responses. And furthermore, the combination of virtual reality and eye tracking is gaining momentum in treating many illnesses, but especially in PTSD. And this is largely due to the fact that VR can help modify behaviors, thoughts, and emotions by immersing the patient in an environment that triggers the memories of the trauma. These situations can be dangerous or difficult to recreate or impossible to control in the real world. So VR provides a safe and repeatable controlled environment for this therapy. I am fortunate that I get to work with many of the researchers and inventive companies who have taken the learnings from the lab and the clinics and improved upon them with their own science, creating remarkable real-world applications for doctors and patients. And I'd like to take a moment to highlight a few of these companies. The first being BrainLeap. They provide attention and assessment for individuals with autism and ADHD. And they do this in fun-to-play, gaze-driven games that they then sell to schools and families. Lexplore, another Swedish company, they were founded in 2016, and they have an innovative rapid reading assessment. It can track and obtain a student's reading level in just 3 minutes, and though it includes high-tech eye-tracking technology, it's super user-friendly. And it helps teachers to quickly identify who in their classroom may be struggling with a reading disability so that they can help them boost their reading ability to get to or above their grade level. Novasight brings together the power of eye tracking and AI to revolutionize vision care, bringing pediatric vision care to the digital age. Their solutions, they accurately assess and treat patients in fun and engaging ways. They're really fantastic. In some cases, it's just as easy as watching a movie, and that's your treatment. And with Right Eye, they're also revolutionizing healthcare and vision performance through innovative tests and training programs. Their tests help providers assess patients' brain health, visual dysfunction, concussions, reading disorders, athletic performance, and more. They follow evidence-based, metrics-driven methodologies. They're nationally recognized by optometrists, hospitals, sports teams, associations, and many more. I highly encourage you to visit the websites for each of these companies where you can learn more about their research and their incredible solutions. And the digital eye tracking solutions, they bring so many benefits to both doctors and patients. So the solutions that I just talked about, as well as others. Because with digital tests, they're more accurate than subjective questionnaires or medical examinations. And in contrast to many manual diagnoses and some other diagnostic equipment with similar results, these tests can actually be significantly less when it comes to labor costs. And since they are objective, they're harder to fake compared to self-reports and other types of tests where a person may be motivated to understate their symptoms. And furthermore, they also eliminate the struggle that some have to properly verbalize what they feel. In most cases, eye tracking solutions are part of a larger ongoing assessment, so they'll provide key pieces to the overall puzzle and are usually add-on services designed to help medical practitioners grow their business, increase referrals, and really differentiate them in a competitive market space. Patients and caregivers can see and monitor results, and as a result, have increased confidence in the diagnosis and proposed treatment and in their overall health care. And eye tracking tests and treatments are easy to administer and complete. They empower remote testing in places like schools and in the home. And they'll speed up and simplify the screening process, which is crucial to start treatment early and significantly alleviate or improve many conditions. And the data can be obtained in real time for almost anywhere and can be used ongoing for monitoring and tracking progress. And so for researchers and companies in this field looking to commercialize their solutions, it's important to find an eye tracking partner who can help take your idea, your research, and scale it into the market. You will need a partner who offers robust and accurate eye trackers and has the technical knowledge and expertise to help you through your journey. The partner needs to have the right type of development kits and software solutions to help you turn your research solution into a commercial product. And solutions that meet your technical specifications, especially when it comes to form factor and sampling rates, because different applications require the data to come in at different sampling rates, and of course price points that can help you scale. And if you're going into medical certification, you definitely need to have a partner who has experience supporting customers through the certification process. It's essential to help you get through that. And that is exactly the principles of Tobii. For those that don't know, we've been around since 2001, so we are approaching almost 20 years. And we've consistently expanded our offering year after year, establishing a presence around the world. We are about 1,200 people across the globe focusing uniquely on some aspect of eye tracking. We provide the technology and the expertise to help companies integrate eye tracking into their products and solutions, and our product portfolio is flexible. We offer various types of eye tracking platforms, both lower sampling rates and high-speed sampling rates. We have the professional services needed to bring your product to the market. We're comfortable working with the largest consumer electronic companies, prominent medtech companies, and pioneering startups, researchers. So we've been doing that, like I said, for about 2 decades now. If I piqued your interest and you'd like to learn more, I recommend visiting our website, tobii.tech.com, if you haven't already, and specifically viewing our healthcare blog series. In this blog series, we talk a little bit more about a few of the customers that I mentioned. And here you can also find a customer success story, where a customer explains why they chose Tobii as their partner for commercialization. And you can also find some good info on that website about the different commercial solutions we offer for those that are integrating eye tracking into their products and solutions. And of course, you can always reach out. So we want to learn about your goals and your specifications and help you get started on your eye tracking journey. And we have several ways to help you get started. So we can get you the right development tools. We have a professional services team that has the knowledge and expertise to help you take your research and your ideas to commercialization. And that can be through training and consultancy, as well as workshops and actual development support. I appreciate you spending time with us today, and I hope you found the session enjoyable and informative. Now, as we discussed, eye tracking is a powerful tool to provide objective biomarkers to assist healthy aging, diagnose disorders and diseases, to monitor disease, and to track therapy effectiveness, and in even some cases treat conditions. Time was limited today, but this is, as I mentioned in the beginning, an area that I am very excited about. So if you have any questions, if you want to continue the conversation, please definitely reach out and be happy to continue. You can email me directly at amanda.bentley@tobii.com. I'm also on LinkedIn, so you can connect with me there to tell me more about your interest in eye tracking, and together we can explore how myself and Tobii can support you. So this concludes our webinar series, Eye Tracking, a Catalyst for Healthcare Innovation. I appreciate you tuning in, and I hope you have a wonderful rest of your day. Thank you.